Welcome back to Get Your Man On. This is Evan Bass. Testosterone replacement therapy. Fountain of youth or not a fountain of youth? We're going to talk to Dr. Alderson as well as hearing some other questions. So, Dr. Alderson, testosterone. Tell me about testosterone. What's your thoughts on it? Treating patients with it. Should guys have it? Should guys not have it? What's your how does it relate to sex drive and sexual function, all that stuff?
Well, testosterone is been a topic of controversy in urology for many years. It's initially when you're young, you have a testosterone spurt when your testicles begin to develop, and that's what increases the testicles in size. And during your teenage years, and when you go through puberty, you have an elevation of your testosterone. And there's a gradual increase all the way up until the age of about 30, where you begin to start having decreases of production of testosterone by possibly 1% to 2% every year. So we used to think that testosterone, well, we still think this, it was a major contributor to libido, sex drive, energy, things such as that, muscle mass. And we just really don't know the extent of it, because every day there seems to be an article in the literature about some function that testosterone contributes to in certain enzymatic reactions or in metabolism of some product. It seems to be involved in more and more bodily functions and issues than we actually realize. The major thing that we're interested in as a men's clinic is your libido and energy, sex drive, desire, and such as that. So it's even been expanded to involve even the cognition that men have. Even women have. So women have a small amount of testosterone also, but their estradiol levels are much heavier. And men have estradiol levels also, but they're not as large, not as great as females. So there's a balance between testosterone and estradiol in men and women, with the reverse in each category. So we know that it does certain things. We know that it's made mainly by they call the Leydig cells of the testicle, and there's a small amount made in the adrenal gland, also in the central portion of the not the central portion, the cortex of the adrenal gland. So it's important that we know that when they come in and we have them fill out a questionnaire. It's called an ADAM score. And depending upon the results of that and the history that you get from these patients, you can pretty much project whether or not they're going to have an elevated testosterone, a low testosterone level.
Doctor, I have a question for you. You mentioned testosterone in women, because I know I've studied in men, if the estrogen is too high, there's unwanted complications for some men. For women, is it similar? If they have too high of testosterone, can it be unwanted? Is there complications or problems?
Well, usually females have a low testosterone, as you mentioned, but if they have an elevated testosterone, usually it's some sort of a gonadal stromal tumor of some type that causes the testosterone to be elevated. I actually have never seen that. My 3-month block in gynecology that I did, I don't think I ever experienced that, but it is administered to females with hypoactive sexual dysfunctions. So if a woman comes in and she's have a hypoactive sexual desire, you can give her testosterone, elevate her testosterone, but there's certain complications that are surrounded that. For instance, they will actually have a growth of their clitoris, which will become larger.
Is that a bad thing?
Well,
What do you mean by growth? Yeah.
That sounds exciting.
Depends on the growth.
Easier for some of us. Oh.
that reminds me of a story back when I was in practice, but I'll have to keep that in reserve. That story.
Oh, come on.
Maybe you don't have to keep it in reserve.
So, I couldn't tell that. I couldn't share that.
All right.
It was at a dinner party, and we were having a conversation about it.
Yes.
So
we get
okay.
in?
that's as far as I'll go with that.
All right.
Okay.
All right. I'll take that. You know, I had a friend who I've known her for 20 years, and she's 50 years old, and I see her at the gym all the time, and she's working her butt off. And she comes up to me and she's like, "Hey, Evan, I know you do testosterone stuff." And I was like, "Yeah." She's like, "I take it too." And I was like, she's like all sweaty and like pumped up, and I was like, "Yeah, oh, that's really cool." She's like, "I like to keep my level around 900." And I was like, 900?
Is that high?
Wow, that's very high.
For a woman?
That's
Like, that's insane.
Yeah.
And she does that. She keeps it 900. Like, there's got to be side effects other than an enlarged clitoris that are bad, right? Like, I mean, that's like kind of normal for a man, right? Like, that's probably high normal, like what we were shooting for when we're treating them. But for a woman, what's their normals like, what, 30 or something?
It's in the sub 100 level.
Yeah. That's wild. So, but she's like, "I feel great."
I bet she does. I bet she could lift you.
No, seriously, she's killing it.
Is testosterone like is it enough to make a huge difference? I mean, when a woman's testosterone is that high, she starts performing at like man strength levels too?
Well, a lot of the female athletes, as you know, that's why they screen athletes for drugs and testosterone.
Right.
Is because it puts them in a different category. If you've got an Olympic athlete that's outperforming other female athletes and she has an elevated testosterone, she's going to be eliminated from the contest because of her steroid levels are too high.
Yeah, that's wild. It's crazy how testosterone. It's incredible. It's changed my life. I mean, I can't believe how much it's done for me. But so I've read some studies about how testosterone is like declining in men as a general population. Do you anecdotally, you've seen a lot of guys, has the patient population over the past several years like gotten younger? Have you seen more guys with lower testosterone in their 20s, 30s kind of thing? Like, what have you experienced that at all?
Yes, I have noticed that. The patients that we're seeing in the office seem to be younger and younger every year that we see them. I'm not sure if it's because of some chemicals that are in the air or in the food that we eat, or they're genetically modified.
Mm-hmm.
If it's having some issue with the testosterone production, but naturally, not naturally, but unnaturally, it seems like the population itself is getting heavier,
Mm-hmm.
and people are becoming more obese, and I think obesity is one of the contributing factors because there's a thing called sex hormone binding globulin that's produced mostly in fatty tissue, and it binds with testosterone and makes it unavailable for use. So they're going to have abnormally low testosterone levels.
Mm-hmm.
So it's difficult to do anything with that. There's nothing that we know of that we can change except for weight reduction.
Mm-hmm.
And that's one of the things that I think we've concentrated on here lately is trying to capture that group of patients that have a low testosterone level and an elevated weight, and get their BMIs back to a normal level of 30 or less.
Yeah. I can't tell you how many patients' lives have seen changed from doing that. Sex hormone binding globulin. I like that for a band name. Danny?
SBHG.
SBHG, sex hormone binding globulin. I think that might be, I'm going to start a small band called SHGB. No, wait, SBG. I'm going to...
SBH.
Coming up, we get Dr. Alderson to share his clitoral dinner party story. Let's see if we can get him to do it after the break.